Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about a condition in the shoulder called impingement syndrome. But before I continue, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So essentially, I wanted to first just talk a little bit about this condition and then talk about certain positions which have the potential to irritate the shoulder if somebody is presenting in this fashion. So essentially, the shoulder, it's a ball and socket joint. So you can think of it as we've got the head of the humerus. It attaches into the shoulder blade area, and on the top portion here of the head of the humerus, there's different structures, right, that go through this space here. So for example, there's a bursa in that area. So a bursa is essentially a sac of fluid that helps to lubricate the joint. We have tendons that run into that area, rotator cuff tendons, and these structures, these tendons, for example, they can get pinched, or the bursa can get pinched when we're bringing the shoulder into different positions and angles. And in a lot of cases, posture, for example, can influence this. Sometimes if we have weaknesses in through different muscles that impact where the position of the humerus is, can impact this condition. And so when we go to this sort of typically around this 80 to 120 degree mark in shoulder abduction, it's called, this space in a lot of cases, it can get smaller. And if there's sensitivities with any of these different structures, like the bursa, like a rotator cuff tendon, this angle can be quite painful, and it can irritate this structure as a result of this reduction in space. And so again, there's certain activities or positions which can cause more sensitivity if somebody has this condition. So for example, if we're driving, for example, right, if we're bringing that arm across and over the chest area, that has the potential to irritate this condition. If we're sleeping on the shoulder, it can kind of push the shoulder forward and again create this potential irritation. If we're sleeping on the other side, but again the arm goes across, that has the potential to irritate it. If we're in prolonged sitting positions, so for example, if we're in this sort of slouched position for long periods of time, and then we go to lift up the arm or go out to the side, again, that has the potential to close down this space and then create this pain in through the shoulder. So I just wanted to go through some of the things to watch out for in terms of positions that we might naturally go into with day-to-day activities, which has the potential to cause some pain if we have this impingement syndrome. If you have any questions or concerns, feel free to leave a comment below, and please check with a doctor or physiotherapist to make sure that this or any other exercise is appropriate for you. Thanks again, and have a great day. Take care.